Good morning. Good morning. My name is Kimberly Bishop. I'm Associate State Director with AARP Michigan, and I'd like to welcome you to another Learn a Latte session. One of the reasons that we call these Learn a Latte is because we'd like our viewers to join with a cup of coffee or tea, or whatever you like, to hear about topics of interest to those who are 50 and older and their loved ones. These sessions are held on the first and third Wednesdays of each month at 10 o'clock. So if this is your first time, welcome, and thanks for visiting us again if you've been before. Learn a Latte is just one of the many virtual events that we host in 2021. If you visit our webpage at aarp.org/Michigan, there's a link for virtual events. You can see what's coming up. The page is updated frequently, so please bookmark it and visit us often. Today's topic is Medicare. Viewers will learn the basics of Medicare, how and when to sign up, and who to contact for help. Whether you're approaching 65 or serve as a caregiver or simply want to be able to help a loved one, this session is for you. Just so we're on the same page, Medicare is the federal health insurance program for people who are 65 and older, and also some younger people with disabilities or specific conditions. It began in 1966 under the Social Security Administration and is now administered by the Centers for Medicare and Medicaid Services. We are fortunate to have today with us Teresa Smith from the Region 2 Area Agency on Aging. She's going to help us demystify Medicare, and I know sometimes it's hard for me to remember the differences between Part A, B, C, and D, but we'll get some help today. We designed these sessions to be interactive, so if you have a question at any time during the program, please type it in the comments section, and I'll have an opportunity to ask Teresa. We may not be able to answer technical questions or those related to a very specific set of circumstances, but we will provide resources and contact information to get your questions answered. So I'd like to introduce Teresa Smith. Teresa is the MMAP Regional Coordinator / Volunteer Coordinator at the Region 2 Area Agency on Aging. She started working with MMAP as a volunteer in 2014 at the Lenawee Department on Aging, but shortly thereafter was hired as the MMAP Site Coordinator. Teresa stayed with the Lenawee Department on Aging until last fall when she was hired into her current role as the MMAP Regional Coordinator. Welcome, Teresa, and thank you for spending some time with us this morning.
Thank you, Kim.
So I mentioned that this is an interactive program, so viewers may ask questions, and you can, if you already know that you have a question, you can type it in the comments section now. But through your work for the Region 2 Area Agency on Aging, the information we'll be talking about, though, it applies to anyone, not just people in Region 2. So it applies for anyone eligible for Medicare, regardless of where they live, correct?
Yes, if as long as if you get Medicare and you're in the United States, you can use your Medicare card anywhere in the United States.
Very good. So first things first, can you kind of give us an overview of Medicare and what it covers?
Okay, well, and it's a lot, but I can try to briefly give you an overview. Yes, happy to. So first, I would say that Medicare, there's two sides. Okay, there's two sides of Medicare. And when I'm describing Medicare, I always refer to my Medicare and You book. And that is the official U.S. government Medicare handbook. So there are two sides to Medicare, and if you go to page 6 of that book, you'll see the two sides. There's original side of Medicare A, B, and D, and then there's also the Medicare Advantage side, which is also known as Part C. Medicare, original Medicare, I should say, it helps if you go into the doctor or to the hospital, it takes care of your medical and doctor services and hospital. So A and B, that's all it does. It's your red, white, and blue card, doctor and hospital. Your Part D, I always say Part D for drugs, that is simply for the pharmacy. That's under Original Medicare. And under Original Medicare, you also have the option of picking up a Medigap plan or supplemental. Medigap supplemental is used interchangeably. It's the same thing. The Medigap supplemental does help pay for the cost with Original Medicare. So Medicare pays 80% of the cost, and you are responsible for 20% plus the deductibles, because Medicare has a deductible, Part A, and Part B has a deductible. If you are under Medicare Advantage, which is also known as Part C, that means you have your Medicare card A and B and C, and usually C has Part D in it. Medicare Advantage plans could be, it's a health plan offered by private health plans. It could be an HMO, a PPO, or a PFFS. It could be like a group health plan that you have while you're working. Okay. And the Medicare Advantage plans, it's one card that will take you to the doctor, the hospital, and the pharmacy. And some of those Medicare Advantage plans do offer some extra benefits, such as your vision, hearing, and some dental.
So those services aren't normally covered.
Correct.
Okay.
Yeah, those are it. You have to really do your homework and look at your plan and ask the right questions, and always ask, what are my deductibles? Because you're usually what you hear on TV or see on the commercials or read in, you might get the mail. It's usually they're quoting you the premium, and the premium for Medicare Advantage can be anywhere from $0 a month to well over $100 a month. But the deductibles and the out-of-pocket maximum is what you're always going to be asking about for those plans.
So if I am approaching 65, so I'm 64 and I know that Medicare is coming, what should I do and when should I do it?
So when you're new to Medicare, so usually anybody who's turning 65, 3 months before you turn 65, the month that you turn 65, and then 3 months after, that's a 7-month period. That is considered your initial enrollment period. And that's the best time to get a hold of, just like you plan your retirement or hope to plan your retirement, you also want to plan what you're going to do when you're turning 65, because, am I going to continue to be working with my employer, or am I actually going to retire and I'm done with working and now I'm ready to go out in the field and just enjoy my life? Oh, but wait a minute, I need Medicare. That should be your first thought. So, and if you do need Medicare, you better look into where to get it, how to get it. And I can tell you where to get it is usually you can go to socialsecurity.gov, SSA.gov, and do it online and enroll, or you can just call Social Security. So if you're planning your retirement, usually you may not be, if you're still working, that is, you may not be still qualified to get your Social Security check. And so you want to call in about that. Are you eligible for full retirement and get your full Social Security? Those are questions you want to ask Social Security. They can be the best people to ask. And while you're there, you can also say, oh, by the way, can I also enroll in my Medicare? Because maybe you don't have a computer. Maybe you're not able to go online to do that. Social Security can help you, but you need to let them know that too, because they're going to assume that you do know how to use your online computer and or your phone, and you can get on ssa.gov and enroll yourself. The thing to remember as well is if you are planning to continue to work until you are at full retirement age, then you have full benefits with your employer, or maybe your spouse is providing you full benefits. That is something that you want to be aware of, because if that is the case, then you may not need to have Medicare at all. And you'll wait until that insurance goes away. Um, and usually at that point, when that time happens, you'll have what they call a special enrollment period. So be aware of that as well. And then there's also those persons with disabilities who are on disability. They went through Social Security, got their Social Security disability. They have to 24-month waiting period, and after that,
Oh, wow.
the 25th month, they would receive Medicare. So when that happens, if they're on Medicaid, for example, and they say, well, I don't need my Medicare card, a lot of people return that card and then they get back only Part A. That is not a good thing if you have no other insurance. So make sure you do have what you need. Make sure if you get that Medicare card in the mail, that means your first question is, why am I getting this? That's when I want you to reach out to us, to MAP.
Okay. So we've had a couple questions. One was, how do we get the Medicare booklet that you mentioned? And if you could hold it up, that would be great.
Sure.
And we had a question from Susan um, asking whether it was available online. And we actually have some great viewers because Bev mentioned that the Medicare.gov website actually has a section where you can download the booklet or the printed copy. So thank you, Bev. You are on top of this. So thank you for helping. So right, we have our viewers who are helping one another. So can you tell me about I mentioned it and didn't really ask you. Can you tell me what the MMAP or MAP program is?
Yes, MAP, MMAP stands for, it's abbreviated as MAP, and it stands for Medicare Medicaid Assistant Program. And it is in the state of Michigan. So that means that if you're out of the state of Michigan, there are other programs through SHIP state health insurance program that you can always contact. If you're 60 years or older and you want to know more about that, I always say go to your area agency on aging and they can tell you all about that stuff as well. But MAP is Michigan Medicare Medicaid Assistant Program.
And we're getting questions in from our viewers. Clay wants to know what happens if you don't register right away, or what if you don't enroll right away?
So, okay, that's so if you don't register or enroll right away for Medicare, and let's say that you're 65 years old, today was your birthday, you still have 3 months you have 3 additional months. So remember, there's a 7-month period. 3 months prior to you turning 65, the month that you turn 65, and then 3 months after. If you missed that whole period of 7 months, or you had a special enrollment period, let's say, and you missed that too, that's the clincher. The clincher is that if you do, then you may have to have a penalty for not enrolling in Medicare when you should have. And oftentimes what happens is people don't realize that, and it's unfortunate. They do have a Medicare regular enrollment period, which is January 1st through March 31st, and that's for A and B only. But even then, your A and B will not begin until July 1st. You will be penalized for the period that you did not enroll and should have.
So is the penalty waiting longer to enroll? Is the penalty financial? What is the
So,
penalty?
so the penalty is 10% for every 12 months for A and B, and 1% per month. 1% of the national base premium for 2020, I believe it was $32.74. That is applied monthly to your premium once you do get it with Part D, and it stays with you the rest of your life.
Oh, wow. So it's really important to enroll
Yes,
when you're supposed to enroll.
yes,
So I have a
absolutely.
question from Joan. She wants to know, even if she's working, must she apply for Medicare at 65?
So if you're working full time with full benefits and you have insurance coverage, your medical is covered, your prescriptions are covered, then no, you do not need to have to enroll in Medicare. It's only when you're retiring, and let's say that you're not retiring, but all of a sudden your employment ended or the insurance has ended. You have nothing at this point. You do have a special enrollment period now, and the first thing you want to do is contact Medicare. What do I do? You can contact a MAP person at any of the area agencies on aging, and we can help you with that as well.
It's interesting. We've had this question come up a couple times. We've also had Roger and Shireen answer this. And we know at ARP that many of our members are still working. And with the Social Security full retirement age increasing, 65 isn't the magic number for, maybe stopping employment. And if you are fortunate enough to have insurance through your employer, I can see that that could be a little confusing. But then would you suggest that people, regardless of whether they're working or not, as they start to get this information in the mail, at least reach out to a MAP counselor or to Medicare just to be sure that they're not making a decision that might put them in a penalty situation later?
Oh, absolutely. And usually when you go to Social Security, if you go to Social Security, let's say that you're interested in knowing how much your Social Security benefit's going to be, they will usually refer you to a MAP person in the Department on Aging or area agency on aging. And usually there are MAP counselors there. And we, as MAP counselors, I'm the MAP regional coordinator. So absolutely, we can tell you exactly what you'll need, because you're right. Not everybody wants to retire now at 65. Why? If you're good, able-bodied, and ready to continue on until you're at full retirement, I know a lot of people who are still 70 and still working and not drawing their Social Security and want nothing to do with Medicare yet. You will have a special enrollment period when that stops. When you decide to retire, you will have a special enrollment, and we can talk to you more about that specifically once we meet with you. And I will say that we're not meeting face to face, unfortunately, because of the pandemic, of course, but we can tell you everything over the phone, or if you have Zoom, we're very willing to work with you on Zoom.
So we have a question from Susan. So Susan's saying, if someone's covered by a spouse's benefits, will she need to enroll until her spouse's benefits go away? So she's covered by her spouse's benefits. If she's 65, she's covered by her spouse's benefits. Does that mean that she does not need to register at 65?
Correct. So if she is covered with her spouse's benefit, she does not have to enroll with Medicare until her spouse's benefit stops. And remember, if you are covered, because there are some employers who continue to give you the retirement benefit, you do not have to change, because you'll be flooded once you're getting to be 65, you will be flooded with all kinds of material in the mail. And then all of a sudden you'll be seeing commercials that you're thinking, why am I seeing all of these commercials? If your employer is still covering you with their insurance after after you've already retired, let's say for teachers, for example, you do what they tell you to do. Okay. If they say all you need to do is enroll in Medicare, then that's what you need to do. And you want to keep their insurance as well.
So I have a question about these MAP counselors. Are they employed by insurance agencies or how are these MAP counselors selected? Because, I'd like to be sure that somebody's giving me a fair assessment of what I should do.
So MAP is statewide again, and we have full training through MAP Inc. They are actually they're housed in Lansing, Michigan. Most of us are volunteers. I started off as a volunteer myself, and some of the staff in our agency is paid in kind, but most of the MAP people that you'll encounter are actually volunteers. There is very stringent training for us, and of course, we go through the entire book, and the entire book is what we go through, in addition to so many other things. So, absolutely, we don't just talk about Medicare people with new to Medicare, but we also help with any appeal process with billing, for example, as well.
We have a question from Joan about FEHB, and I don't even know what that is.
FEHB?
Yes.
I'm not sure what that is either.
So, Joan, if you can type in the comments what FEHB is, we'll try and get back to you.
Yeah.
We have a question from Janine, who wants to know what does it take to qualify for both Medicare and Medicaid?
That's a good question. So to qualify for Medicare and Medicaid, usually anytime you're low income, there is a qualification on income, of course, income and assets. And that's one of the things that we are trained as MAP counselors is to ask those right questions to see if that person is going to qualify for any of the Medicare savings programs that we do have. So we have Medicare savings programs to help with paying for your Part B, as well as helping you pay for the Part D. The actual number for the Part B is less than $2,000, let's say that, a month, and that's before deductibles. And your assets should not be more than $2,000. And I'm not talking about your home or your car, your personal belongings, but I am talking about you. Let's say you're at home, your income is, let's say, $800 a month, before deductions. But you have a little shiny red Corvette saved in the garage because you want to make sure your grandson gets that. Well, sorry, that's not going to cut it. So that is considered an asset, a valuable asset, and that would not qualify you for Medicaid, because you have to enroll in that Medicaid program in order to qualify for Medicaid. It is tough. I'm not going to lie.
So Medicaid is more for lower income at any age, whereas Medicare is for anybody at 65. Is that correct?
Anybody who's turning 65 and or who is on disability, who's been on disability for 24 months, or if they're on ESRD, which is like if you have had a kidney transplant or something like that. It's usually how it goes. So you have to be
the end stage renal.
disease.
Okay, renal disease.
Or have ALS.
Okay. So I have a question from Sherry. She wants to know when she's eligible to enroll, does she look to purchase a Medicare Advantage plan first or enroll in Medicare first and then look to purchase the plan?
You cannot enroll in Medicare Advantage unless you have Medicare A and B. And why? That's because I always give the example of, let's say that you need crutches,
Mhm.
and your policy with Medicare Advantage says, well, you pay 20% of anything that's durable medical equipment. If that's the case, then you say, okay, fine, I'll pay 20% of those crutches. They're not paying the 80%, they bill Medicare for that 80%. And that's Part B of Medicare. So yes, you have to have A and B on both sides, whether you're under original care or Medicare Advantage, also known as Part C.
Okay, so we have a few more questions. They're kind of really coming in. We have a question from Catherine who wants to know, do you need to enroll in a Medicare Advantage plan if you enroll in Medicare? Did we just answer that?
No, you don't have to enroll in a Medicare Advantage plan if you have Medicare. So remember, there are two sides. So imagine the T, and above the T is Medicare A, B. And on one side, underneath the T is original side, and on the other side is Medicare Advantage. And that's where I say, turn to page 6 of your book.
Okay.
Original Medicare would be A, B, and D. And Medicare Advantage side is A, B, C with D in it.
Okay. We have a question from Carol. She says she just turned 65 in March. She's still working. Does she have to sign up? And we've answered that, but perhaps she just joined us a little late. And the answer to that is no, she doesn't have to sign up if she has insurance through her employer. But
Right.
she may still want to contact a MAP counselor just to be sure that she's making the right decision while she's in that 7-month window so that she's not assessed a penalty that will stick with her forever later.
True.
Okay. Carolyn asked what was the difference between Medicare and Medicaid, and I think we just covered that. Joan would like to know, actually, Joan was answering a question. Um, John wants to know, why do you have to pay for Part B? And so this is another question. And Lori would like to know, Lori's a retired teacher, will be 65 in August. She has retirement insurance from the state of Michigan. Does she still need to choose a Medicare plan? So the two questions, I thought they were related. I'm sorry, they aren't. So John wants to know, why do you have to pay for Part B?
Okay, so I always use the example of going to the hospital. So you go to the hospital, Medicare Part A is hospital care services. So if you're going into the hospital and you're admitted, not in observation in the emergency room, but you're actually admitted into the hospital, they give you your bracelet and you're there at least one day for 24 hours. While you're there, your doctor comes into the room, or let's say they take you out for x-rays, or if you need oxygen, or you need an MRI, a CAT scan, or blood work for the lab, or you walk out the door with crutches. All of that is the Part B. Part A is usually, I always describe it like a hotel room. You have your room and you have your bed. Everything else is extra, and that extra is Part B, your doctor. So even if you don't go into the hospital, you just go visit your doctor, that is your Part B. And that does cost you $148.50 each month. It comes out of your Social Security automatically. You won't ever see it if you're not drawing Social Security. If you're on disability drawing Social Security, then you will definitely miss it once you start getting on Medicare A and B.
We have a couple more questions. Do you have time for a couple more?
Sure.
Okay, so the question about FEHB, it's the Federal Employee Health Benefit. That was the Federal Employee Health Benefits. So I think since that's a very specific thing, that she may need to call a counselor about that or call the insurance provider. So that's not really
I'm
specifically
thinking
about
that's like a
Medicare.
post office, the
Right,
postal worker
right,
perhaps.
right.
Yes,
So I don't know
yes.
that we can address that specifically, but I did want to let her know that we do see your question. So I've got three more questions.
Hmm.
Leon would like to know, he's retired and receiving a pension and health insurance. Should he apply for all parts or just A and B?
He's retired and what? I'm sorry.
He's retired and receiving a pension and health insurance.
Oh,
And
okay.
I think my neighbor's landscaper now is really kicked up, so I do apologize if there's a lot of background noise.
Okay. So if you're retired and receiving a pension, good for you.
And health insurance.
And health insurance, I'm not sure where you're receiving your health insurance. I'm going to say that you're probably receiving it from a spouse. Then yes, good for you. It's when that insurance stops. Let's say your spouse is now going to retire in, let's say in June. Then you want, or let's say until the end of this year, you want to plan in advance when you know that that person's insurance is going to stop for you too. That's when you need to make sure that you enroll in Medicare. And, and if you have, again, if you want more specific answers to your question, then I would see a MAP counselor for sure.
Okay, this is a general question. Um, Rhonda says she read that she can't sign up for, oh, screen moved a little bit, can't sign up for Medicare Advantage Part C until she's been on A, B, and D for 1 year. Is that true?
So that means that you enrolled with Medicare and Part D initially, is what I'm thinking, that you got into Medicare and you probably didn't know anything else except to get into your A, B, and you knew you had to have Part D, which is a good thing. And the reason you might have to wait a year is because Medicare has specific enrollment periods. And October 15th through December 7th is the annual Medicare enrollment period. That is the only time that you can actually enroll in a different Part D or a Part C. So if you're under original Medicare and your Part D, let's say your prescription drug plan did not work for you for whatever reason, or if your prescription medication was not in their formulary, you may have to wait until that open enrollment period in order to change that plan, and it will not begin until the first of the following year. Yes. Or you can change it in Part C as well.
Okay, I'm going to ask one final question before we close, and it's applicable. I think will help everyone. How does someone find a MAP counselor? How do they contact a MAP counselor?
So I always say call the MAP Medicaid, the MAP number, which is the 800-803-7174 number. Or you can just go to MAP Inc., MMAPINC.org. Or you can go to any of your area agency on aging or department on aging, and just ask for a MAP counselor. They will know who to contact. Tell them that you're asking about Medicare, and they know who to refer you to right away.
Very good. Thank you, Teresa, so much for joining us today. We had lots of great questions. You gave us lots of good information. Do you have any final thought that you'd like to share as we close today?
I would say just go to your MAP people. MAP, we're here to help you. So we provide individual insurance counseling for people with Medicare, and we're here to help you. So please, I work with Region 2. Give us a call or reach out to that 800-803-7174 number, and you'll get some help. Thank you, Kim.
Well, Thank you so much. I appreciate you being here with us. Always appreciate the fantastic information Region 2 has to share with us. I'd like to remind our viewers to visit our webpage at arp.org/Michigan to hear about more events. And we are going to close this. And I look forward to seeing viewers again for another Learn a Latte and some of our other fun and exciting events. And on this note, I'm going to close so that we don't have to continue hearing my neighbor's landscaper. So we're all adjusting to the virtual world. And so it was good to hear that people can still get help virtually, either virtually or by phone with the MAP counselors, because it's such an important topic. And it's not something that you can just always go online to get the answers to your questions. So thank you so much. Thank you, viewers, for joining us. And thank you, Teresa, for being here today. We look
Absolutely.
forward
Thank
to
you.
seeing you again soon. Have a